Welcome back. Daily show at 9:19. Little bit of change. Always great to talk to Dr. Dennis Sands, who joins us now, Chief Medical Officer with OSF St. Anthony's, as we continue our conversation during National Women's Health Week. Dr. Sands, how are you today?
Good. How are you doing?
Really good. And, great to have you back on the show. And I know a couple of months ago, we started to have this conversation about, the importance of, the pap smear and HPV leading to cervical cancer. And no better time to kind of rehash this conversation during National Women's Health Week.
Yeah, totally agree. We also have, Women's Health Week, and we also have it's Hospital Week as well. So we're having a lot of festivities for our team and our mission partners here at OSF St. Anthony's in Alton. So it's exciting.
And what really has been kind of, fun for me with all the folks that are coming into the studio, just seeing how everyone's kind of just enjoying the week and really recognizing it too, because you guys have just an amazing staff from top to bottom over there.
Yeah, they are pretty amazing. We also just, again, were awarded the Leapfrog A score for quality and safety, in the metro region, Eastern Metro region, which in this last rating, none of the other hospitals achieved that A grade. So we're very proud of that.
Wow. I mean, that's really incredible. And have you had a chance to kind of take a moment and, reflect and recognize some of your contributions and your teams this week too?
We have, yeah. It's a team effort. It's a big lift. We really thank our nurses because they do the bulk of the care that we see, in hospitals and in medicine in the United States. And then also our nurse practitioners and, of course, our physicians. But we just have so many people that take care of patients now. Our patient care techs and our assistants. We just have, even our unit clerks and environmental services. We really just have to thank everyone for such a tremendous job and commitment to excellence.
Oh, 100%. And, as we, dive into this conversation, Dr. Sands, how should we really start this conversation off? Do you think a refresher on what, HPV is the best way to kind of start this?
Yes, that sounds great. So, when we look at the HPV virus or human papillomavirus, we're aware of about 100 or over 100 different strains that are out there, in medicine. And while we know there's about 100 or so, and probably, a few more, there are about 30 predominant ones that can manifest or, be basically contracted by humans. And those are the ones that we worry about that can actually cause things like, abnormal pap smears and things that can, of course, then down the road become something, even if it's not treated or followed up on or the surveillance isn't done, it can turn into a cervical cancer. But we also see other things caused by the HPV virus, like, warts, things like, flat kind of, warts or even vulvar or genital warts, which are readily treatable. But yeah, there's a lot of these types of things that the human papillomavirus can cause. So we try to be sure that we, catch that and make that diagnosis in people when we see it.
Does that become a conversation whenever you're having, these conversations with patients that come in? Because I'm sure, if I'm, especially if you're younger out there and maybe don't understand, how the body works yet or don't have a full knowledge on this, I could see how, if you tell somebody, well, that, that planner's ward is, HPV, does that conversation, do you have to kind of explain that a little bit?
You do, yeah, because, all patients with warts have a viral infection, which is interesting for sure. But also the accrediting bodies even came out years ago with the recommendation of, if a young woman is sexually active at all, you should screen, and if they're not sexually active, then, you don't have to start early screening. You would screen later. So it's important because if we catch that in a young person, say HPV virus is present on the cervix, which is the lower part of the uterus, then we know that we can follow that because most women under 30 will clear that HPV virus and it'll never become dysplasia that then could go and become years later a cervical cancer. We know that those young women clear it. And for those women over 30, 31, we have to, follow them a little more closely because we know that the clearance rate is doesn't happen as readily as we age.
Well, and I think the last time we were talking, Dr. Sands, you guys were having screenings, weren't you?
Yes, yep, they have screenings for HPV, and the main screen that's out there is a molecular screen. It actually looks for the molecular genetic material that is in the DNA, RNA of the HPV virus. So it's super sensitive, right? Because it's able to capture that. It's a liquid medium, so it's pretty slick, and you screen for that in young women, and then you're able to diagnose and treat it or follow it more closely with the screening. So in essence, with pap smears, that's one way we screen, and we can also send the HPV screen along with the pap smear. So the pap is just a cellular exam, or a cytology, if you will, that you can look at the cells on a slide. And that used to be the old way, but now with the new molecular technology, we have the HPV screens, where we can actually look at the molecular level for the HPV virus. And if it's present, then we know we have to follow those patients more closely.
Well, and I could only imagine, just for someone like you that's just all the studying and all the research, and just like every doctor that's in this field, to have those screenings. I mean, it just seems like they're so valuable, and just the more that we talk about it, it just seems like it's made everything so much more efficient for everyone involved.
Yes, it certainly has. So it's we see decreasing rates in great parts of the country due to the screening, since it's become available, decreasing rates of dysplasia, and also decreasing rates of cervical cancer in a lot of areas. So, and that's for folks who go and get screening. However, unfortunately, we still see a lot of patients and women who don't go and have their PAPs and their screening done, that then show up later with a severely dysplastic precancerous lesion, or even an overt cancerous lesion, and then you have some real risk of a bad outcome.
Why do you think the reasoning is for that? Do you have any explanation or any thoughts to why maybe a woman's still not getting their pap smear?
Yeah, when you look around, read the studies, what you find is a lot of times there's social determinants of health involved, meaning the young woman didn't have access to healthcare, or didn't have access, or a doctor, a nurse practitioner, or even the finances to go see a physician. And so that's very sad. So we do work on those social determinants of health. And I think the other big thing is just the, fear of an exam, which is very normal and rational, or fear of a pelvic exam that could be a little uncomfortable, which certainly, is true in some patients. So I think, we always try to educate that, it might be slightly uncomfortable just for a few seconds, but it's really not that bad, and you'll do great, and it could save your life.
Well, and now just to refresh our audience too, how often should we be going to get these screenings and pap smear?
Yeah, so in younger women, basically they recommend doing them, with the routine PAPs every, 3 years. And then, if you actually do co-testing after 31, so to say the 30 to 65-year-old age range, in those folks, you can do just a PAP every 3 years, or you can do a PAP with the HPV screening we were just talking about, because it's so sensitive, every 5 years, which is what most patients opt for, because they want to avoid the exam, right, whenever they can. So
right.
If you do the PAP and the HPV screening, you can push those off to every 5 years. From 31 to 65 years of age, and then generally 21 to 30 years of age is when we're doing them more frequently, every 3 years. And so younger women, or 21 and under 21, that have not been sexually active, really don't need pelvic exams or pap smears at that point.
And then just to circle back to this, for the 21 to 29-year-olds too, is the HPV co-test not available for them at that point in time?
No, it is, and certainly is recommended, in certain groups, and you can do it. You're not wrong if you do it, if you send the HPV screen. So we send them. We currently send them because they're so sensitive. So, that is standard of care as well, to send it.
What if somebody had a hysterectomy? Are they still, are they still needed to go for their pap smear too?
It depends, and a lot of times they don't need them anymore. So if they were low risk or never had cervical dysplasia to begin with, or their hysterectomy wasn't done for uterine cancer, or it wasn't done for cervical, severe cervical dysplasia or cervical cancer, then you can sometimes no longer do the pap smears. They may not be necessary, but there's a few recommendations, a few medical recommendations around that. So it's best to discuss that with your physician or your nurse practitioner to see whether you still need those or not. But just a general answer to that question would be most women are low risk status and therefore don't need pap smears anymore. But there are some high risk ones that do still need them, and we don't want to miss those ones.
100%. And as somebody's preparing for their pap smear, what's that process look like? Is there any prep work that's required of this?
I mean, it's pretty basic. Obviously a lot of people just, want to take a shower and clean up. And we do ask that, if they can, not to have been, sexually active right before, but there's really not much to any preparation. There is, the question of, can you or should you do a pap smear if someone's currently on their, menses or their menstrual flow? And most docs will still do them if the bleeding is light, because the new thin prep paps that have the HPV screening, technology are actually a liquid medium. So the cells are suspended in a liquid and the blood cells are washed away. So it's light bleeding. When someone's on their flow, you can still do them. However, if it's heavy bleeding at the first couple of days of flow, menstrual flow, then usually you'll wait. So it is easier for most people to just try to schedule those appointments away from when they're due, to be on their menses and menstrual flow. So that's just usually easier for them and easier for the doc.
Well, and on top of that too, how long does it take for these test results to start coming back?
Most cases we get them back in 2 weeks. If the labs are really, super, or 10 to 14 days. If the labs are super busy, then it can be, 2.5 weeks or 3 weeks at the most, but we get them back pretty quickly.
Well, and Dr. Sands, as I know we're wrapping up our conversation here in a couple of minutes, I wanted to circle back to HPV here really quick. What's the treatment look like for that? I know you can't rid the virus of your body, but whenever it comes to just the process for if they're warts or you name it, what's that look like?
Yeah, so for warts, there's readily treatable with things like, just touching with trichloroacetic acid or TCA. Or there's a medicine called Aldera, imiquimod or Aldera, which is a great, cream that you can actually put on for several weeks, and it will, make those warts kind of disappear, which is pretty nice, pretty slick. And then there's some other medicines like Condylox and things like that you can use. So the warts are readily treatable. A lot of times you can even freeze them or, kind of cauterize them off. So readily treatable and, not a real problem. For dysplasia of the cervix, which is also caused by the HPV or human papilloma virus, a lot of times if that's mild, you just observe.
Okay.
In those women, because, if they're under 30, 31, a lot of times their body will clear and basically eradicate the HPV virus on their own. As women age and get above 30, 31 years of age, a lot of times the immune system will not clear the HPV virus. So we'll do surveillance more frequently on those women. And if they actually progressed to a severe dysplasia or precancerous lesion of the cervix, then you would treat that with a little biopsy called a cone biopsy or LEAP biopsy, which is a loop electrosurgical excision procedure. A very, very small little biopsy treats the severe dysplasia and not only removes it, but also cauterizes a few adjacent cell layers to eradicate any HPV virus that was even left in the cervix. So usually after those LEAP procedures, the virus is gone, almost always.
Wow, that's very interesting. And honestly, that's why I enjoyed this conversation so much the last time, because it's just so insightful too. And I think that the more that you have these conversations, Doctor, I don't know if you agree with me or not. It seems like the more it just seems like more of that problem goes away the more you talk about things like this.
Yeah, so true. Because then when people they kind of lose that fear that they can get through a few seconds of discomfort, and do the screening, or hey, even if I do have a severely dysplastic or precancerous cervical lesion, I know I can get treatment, and then that way I'm not going to disappear and come back, 5 years later, where it could have actually grown into a cervical cancer, because then you may not be able to totally eradicate it at that point. So, yeah, I think you're totally right. I appreciate the opportunity to speak on it, because education is the key to preventing these things. And, even when you talk about what HPV does with the new Gardasil vaccine that's out there, which is, 2 doses for young women, 3 doses for women after 15 years of age, that prevents, especially when given before first age of sexual intercourse, that can prevent, acquiring the HPV virus at all. So, that was certainly groundbreaking work there.
100%. And Dr. Sands, before I let you go, anything else that we need to discuss on this topic for now?
No, I think we covered most of the issues, how important it is for surveillance, see your doctor, not just for women's health, but for, normal routine health and maintenance for, healthy weight, even talking about diet or exercise, to be sure that, you have healthy blood pressure. So, obviously we look at our patients in the whole, and a lot of the issues that we see are not, female. They're related more to, hypertension, diabetes. We have a lot of overweight patients in the United States, which is related to diet. So we like to, talk about all those issues and help people to be as healthy as they can.
Absolutely. And Dr. Dennis Sands, Chief Medical Officer for OSF St. Anthony's, I hope you have a great rest of your day. Thanks for joining us, and always for the great conversations, and enjoy the rest of hospital week.
Yep. Thank you, CJ. Appreciate it.
Not a problem. We'll take a quick break. 9:36, a little bit of Change More Daily Show on this Thursday morning comes back to you next.